let's break down one of the biggest myths about breast cancer.
Good.
There are two big ways that we treat breast cancer.
Okay.
They contribute to the confusion in the public.
Okay.
So when you're diagnosed with breast cancer, we focus on two big things: local control and systemic control. Local control refers to what we're doing for the breast and maybe the lymph nodes that are underneath the armpit. Two different ways we can do that. We can do that with surgery, a lumpectomy, or a mastectomy, okay? Lumpectomies are usually combined with radiation. However, a lumpectomy plus radiation versus a mastectomy, I know we're getting biological here,
No,
but
it's
people
good.
can play
It's
it
good.
back. Lumpectomy plus radiation or a mastectomy are equivalent in terms of survival from breast cancer.
Wow.
Okay. Why is that? Because what makes breast cancer potentially deadly has nothing to do with what's in your breasts. If I had both my breasts filled with breast cancer and it was rock hard and it looked weird and I touched it and it was terrible, but those cells never traveled outside my breast, it would never be a threat to my life. So when women say, I want to get a bilateral total mastectomy, I was diagnosed with breast cancer and I never want to die from it, that doesn't make sense. It doesn't
Wow.
make sense
Okay.
because the risk is, did any sneaky cancer cell travel?
It's a lymphatic system, so you're looking at your
Lymphatic
lymph
or
nodes.
blood, we don't know. So the second purpose of breast cancer care is systemic control. And there are different ways that we do that with hormonal therapy, with chemotherapy, depending on the type of breast cancer a woman's diagnosed with. So when a woman says with stage 0 or stage 1 breast cancer, I never want to die from this, I'm getting a bilateral mastectomy, there's no logic in that because it's about what we're doing to find or decrease the risk of what we call metastatic disease. What local control does, if you get a bilateral mastectomy, is decrease your risk of a new breast cancer or a recurrence
Wow.
from the one
Okay.
that you had. So if you are diagnosed with an early stage breast cancer and you say, I want a bilateral mastectomy, maybe you're saying it because you don't want radiation. Maybe you're saying it because the stress of going for a mammogram is so damn high. I never want to go through this again. I don't want to worry about a new diagnosis of breast cancer. And that's what's driving the decision. But it does not change the curative outcome from breast cancer. What changes the curative outcome is whether any cancer cell escaped and is looking to
I had no
build a
idea.
tumor elsewhere.
I had
Most
no
people don't
idea.
know. Most doctors don't know.